Welcome to Ask Dr. Jason. This is Dr. Jason coming to you from beautiful sunny Los Angeles. We usually do this show on a Friday, 12 p.m. Pacific Standard Time. Today it's a Monday because we missed Friday, so here we are. We've got a bunch of questions today. Thank you so much for tuning in. We love your questions. Let's roll, Bridge. What do we got?
All right. We've got a question from Anna Comist. Says, hey, I fell 10 feet last week onto a metal suitcase.
Wow.
Landed on the middle of the left side of my back. I ended up going to an urgent care last night because I was in so much pain and couldn't find a comfortable position. I can't really walk. My feet go numb if I stand for more than like 5 minutes. The doctor at the urgent care said that I most likely had some internal bruising that was healing on its own and that the muscles on the left side of my back were all messed up. I'm on muscle relaxers, ibuprofen, and Tylenol, switching between the two, icing and heating the area, and doing some exercises for my back. I've been doing this for a week. I haven't seen any improvement in the pain without meds, and I don't want to take them for much longer. But I also don't want to hurt my back more. I don't want to make the internal bruising worse. Should I go see a chiropractor?
Okay, that's a great question. Very incredibly detailed. Thank you for the detail. What was her name?
Anna.
Anna. So here we go, Anna. First of all, wow, you fell down and that sounded like it hurt. Second of all, you did mention that both your legs or feet, I believe it were numb. Now, typically if you've got numbness in the feet or the lower legs, you're having the nerves from this bottom area of the spine right here, L5, S1, that are affected. However, if you have both, then it's typically the spinal cord being compressed, maybe from a disc herniation, maybe from inflammation and subluxation. I would most definitely go to a chiropractor. It sounds like the urgent care doc did a good job of, helping you get out of pain in a sense, or maybe just helping you through the situation, which was a crisis. Although telling you your muscles were messed up, I mean, of course the muscles are firing at a high level if the spine's been jarred. I mean, here's basically you, and here you are, you fell down onto your side, and hey, look, the spine's out of alignment. So I think that definitely you need to go to a chiropractor, and God bless, let's be more careful in the future. I've had falls in the past. It's not fun. My heart goes out to you. Definitely get to a qualified chiropractor. I would definitely have some x-rays done of your spine. Thank you for the question. Next question, please. Come on, let's roll.
All right, Mac Attack 16102 says, do you have any advice for me? I'm 14, I'm a fast pitch softball pitcher, and I keep having shoulder pains.
Ooh, fast pitch softball, Mac Attack. All right, bud. So fast pitch softball, you're winding that arm around. What I want you to know and understand is that the shoulder is suspended to the body, specifically the spine, via muscles. If you're moving your shoulder around, and I'm limited space here, that's why my pitch doesn't look like yours, but if you're moving and rotating that shoulder around, chances are if your spine is out of alignment in your upper back or your neck, not only is that going to mechanically hinder your motion and thus make you sore, maybe make you use other muscles that you don't normally use, recruit muscles that you're not supposed to use, but also if you have subluxation, the nerves are not going to fire properly. You're not going to have full recovery ability. You're not going to have full muscle firing. So what I would do is I would look to do calisthenic type exercises where you're supporting your body weight, you're putting your body in positions, doing whether it's pull-up, push-ups, etc. So you're really toning the intrinsic internal muscles of your shoulder. Then what I would do is also see a chiropractor to make sure those muscles are turned on. That's everything. Great question. Thank you. Next question, please.
Next question. Hello, Dr. Jason. I have a problem with my lower back, maybe around 2 years. Happened a few times when I played basketball. After the game, I can't bend and touch my toes, for example. But since the last time I played, I have a problem. The pain went from lower back, goes even lower on my left side. I don't know what to do, and chiropractic in my country isn't so popular. Can you give me some advice?
Got it. Definitely when you've got lower back pain or you've got a problem similar, it's tough if you don't have a chiropractor around. It's like, what do you do if you have a dental problem and you don't have a dentist? I mean, obviously you can like cut down your sugar intake, you can swish water around in your mouth to clean it, you can floss and brush your teeth. At some point you've got to basically say, you know what, if I've got this problem, I'm going to save up and go see a dentist. I might not be able to go today, but I'm going to go. And if my tooth problem was so bad, I may have to call upon my family and say, mom, dad, brother, sister, whomever, I need some help. I got to go to the dentist. So it's kind of like that with chiropractic, where you know, I'm sorry that you don't have quality chiropractors in your country, wherever that may be. Do we know what country he's in? We don't. But realistically speaking, if you've got an injury and you've got pain and you've got problems, you can do your part. You can do core strengthening to keep your spine tight. You can eat a low inflammatory diet, so eating things like very paleo, very clean and green. And then what you can do is basically you know, exercises to strengthen yourself, but at some point you really have got to get over and see a chiropractor. You've got to do it. So thank you for asking. Next question.
DeSun31 says, hey, Dr. Jason. First of all, I appreciate your videos. They're really informative.
Thank you.
Got a quick question for you.
Let's do it.
I got to do a few adjustments on my spine, lower, upper, middle back, neck, and on the left shoulder blade. My chiro said in order to do my adjustments and get optimum results, I have to see him for 12 months, which includes 3 times a week for 3 months and 1 per month for another 9 months. Is this time frame correct?
Got it. So that's a great question. Do we have a name?
DeSun31.
DeSun31. Thank you, DeSun31. So DeSun31 is asking, the care plan is 3 times a week for 3 months, was it?
Yes.
And then once a week for 9 months?
Yes.
And he says, is this the correct care plan? And the answer, DeSun, is I have no idea. I haven't seen your x-rays, I haven't done your exam. However, what I can tell you is that number 1, I have put people on care plans similar to this before. Number 2, it depends entirely on how your spine looks on x-ray, what levels of inflammation you have in your body, how well you stick to your appointments, how well you do any home strengthening exercises. There really are a lot of variables, but I think what I will tell you that will help you is that it does not sound like an outrageous program. Many people, as a matter of fact, I had several new patients come in today, both in their 80s or 70s and 80s, and when we took a look at the spine on x-ray, we see terrible curvature and much pain and hip replacements, and many people don't realize until it's too late that you have to take care of your spine, otherwise it degenerates. It will cause and create a lot of other problems, both because the nerves go to muscles and also because they go to the organs, but also because if you're out of alignment or out of balance, you're going to wear and tear unevenly in your joints. So it does not sound at all outrageous. It very well may be a good program for you, but I would definitely encourage you to speak more thoroughly with your chiropractor so that you could say, hey, I just don't understand this, this, or this, and would you explain it to me? And that would be great. Thank you so much for asking. Next question, please.
Next question is from Devin Bivens.
Hey, Devin.
Hi, I'm 14. I play sports, and in August, I pulled my hip flexor.
Ouch.
Eventually, it healed, but then in October, I pulled it again. It hurt really bad to walk on, and I could not run. I was playing field hockey at the time. I run so much, but lately it's been hurting at certain times when I stand up, or at night I've been running. Is there any specific stretch I can do to help my hip that you would recommend?
Excellent. Yes, and thank you. So you strained a hip flexor. Your hip flexors are in here. They flex the hip. I'm going to illustrate that for you. So we're standing here now, and the hip flexor muscles are right here. They do this. They bring the hip up or the leg up and out like that, and they attach into the front of the lumbar spine. And so guess what? You strained your hip flexor, and what you do is you go, hey, I need a stretch. What do I do for my hip flexor? What you do is you ask Dr. Jason, and Dr. Jason says, hey man, look, I was a massage therapist for years. I've worked on a lot of hip flexors. I still do work on hip flexors, although not as a massage therapist. And it is always a result of poor or improper spinal motion that causes the muscle to fire up normally, maybe tighter than normal, in a spasm, in a protective mode. And so by checking and adjusting the spine as necessary, not happenstance, but actually measure, your hip flexor problem will likely go away. So the hip flexor problem is a symptom. The spinal subluxation is likely the cause, although of course you must get examined. Go to the chiropractor. Thank you for that great question. Next one.
Maddie Montgomery says, hello, Dr. Jason.
Hey, Maddie.
I've had a twisted vertebrae for a few years now that randomly causes me pain in my chest and back.
Got it.
I went to a chiro for it, and he told me it was my 7th thoracic, and that was twisted and pushing on my rib, causing the chest and back pain. I went a few times, but nothing got better, and was wondering if I should find another chiro or if I should go to a doctor.
Great question. If your 7th thoracic vertebrae was out of alignment, then obviously the doctor should be able to show you that on an x-ray. and if this was causing you pain, then you should experience some bit of relief. We have patients that experience great relief after one adjustment. Sometimes it takes a few weeks to get the level of relief they've wanted, sometimes even a few months. What I will tell you is that if you're in communication with the doctor and you follow the care plan they have, then you've got to have a little bit of faith, otherwise why go to the doctor? As far as the medical doctors are great for crisis care. If you feel that this is a crisis or if your chiropractor is not able to help you, I would definitely go to your medical doctor. Although from what it sounds like a chiropractic problem. I would just maybe have the doctor review with you the films, review with you the treatment plan, but it sounds like everything is fine. It does not sound like you've had that much treatment, that many adjustments, and that may take more adjustments for you to get the relief you've sought. So definitely converse about this, talk to your doctor, communicate. I'm a big communicator. I communicate with my patients all the time. It's no big deal. Great question. Next one, please.
Okay, Sarah, 190815 says, hey, Dr. Jason.
Hey, hey.
I admire your work so much.
Thank you.
I really come to know you through Team 10.
Come on.
Do you know any type of treatment that could help? I've had a hip injury for about a year now.
Okay.
And about last week, the pain came back worse than ever.
Ouch.
Do you know anything that could help me out, please?
Yes. Okay. Your hips are down here. Many people in the public refer to your hips as here. Your lower back, your sacrum, your pelvis area, but the hips themselves are here. Hip injuries are usually resultant of the lower back. Subluxation, out of alignment, affects the nerves, affects the muscles, unequal weight distribution causes the hip problem. You need to get your lower back checked by a chiropractor. If you do actually have a hip injury, again, and it's not from there could be a muscle imbalance, it could be a strain, but you most definitely need to get checked by a chiropractor. Most people are chasing symptoms, hey, my elbow hurts, when their neck is out of alignment and those nerves that go to the elbow are not firing or functioning correctly. So again, I see many hip problems. Most of them are caused by the lower back. Definitely go and get a deeper look. Chiropractors, we look for the cause. It's not always the spine, but many times it is. Great question. Thank you. Next question.
James Gill, 88, says,
James Gill, all right. What's up, James?
I'm a high school senior and I'm a high school student now going into my senior year. I have a general idea of what I want my future career to be.
Excellent.
Obviously physical therapy and chiropractor.
Okay.
I was wondering...
Two very different professions, by the way, but go ahead.
I was wondering, what did you do to get where you are now?
Got it. So I went to chiropractic college. I graduated in 2005 from Life Chiropractic College West. We need more great chiropractors and we need more great physical therapists. Physical therapy deals with the rehab of the muscles, the joints, the ligaments and tendons, etc. Chiropractic deals with specific scientific chiropractic adjustments, correcting spinal misalignments, and sometimes we do rehab procedures. However, our focus is to correct the spinal subluxation. So I would personally recommend that you follow your heart. Like I said, we need good PTs, we need good chiropractors. Follow your heart, do what's best for you. I recommend as a chiropractor you go to a principled school like Life West, Life University in Georgia, Sherman College on the East Coast. If you have any questions more, reach out to me about that. Great question. Next one, please.
Okay, Jenny Cakes Bakery says,
Jenny!
Just wanted to say that I love your videos and they inspire me.
Come on. Does anybody else get hungry when you read Jenny's Cakes Bakery? Come on. Okay, what else?
I'm considering going into the field of chiropractic. The only thing is, I haven't been to a chiropractor myself.
Love it.
Wish you were near me. Just pretty afraid of going to any random chiro. I have a question. How do you help or treat a patient that has extreme fear of getting adjusted? Or someone that's just scared, like to the point where they start getting emotional? Have you had cases like this?
Yeah, many cases like that, Jenny. You know, it's kind of like, I liken it to, okay, it's basically as if you're telling me, hey, I'm emotional, I'm stressed, I got a lot going on, and I'm just like nervous thinking about it. You're already telling me there's a ton going on with your body and your mindset and your emotions. And by the way, that's not a bad thing. God bless you, and congratulations to you for speaking that out. What you basically do is you acknowledge, like, yeah, I've got some emotional stress probably in my body. I'm super nervous about going. Why would you be nervous about going to a chiro? It's like being nervous about going to get your oil changed at the car, being nervous about going to the dentist. I mean, people usually don't want to find out something's wrong. You know, that's why they don't like going to the doctor. I say it's a lot more empowering to deal with it, to deal with your health, rather than to like avoid it until you're like the person that came in his 80s and the spine's like this. And we can't do anything for that other than provide relief and improve quality of life. We cannot correct that type of spinal problem at 85 years old. So the way we deal with that is we take our time. We spend time with them during the examination. We educate them. We go slowly with our examination. We make sure that they understand everything. There's a lot of great chiros out there, so definitely get to a chiropractor. If for any reason you don't like your experience, just move on to the next one. No big deal. It's like an attorney, or it's like an oil change, a Jiffy Lube, or wherever you go. If you don't like the service there, just leave, go somewhere else. But you know, we do need oil changes. We do need chiropractic care. So just make sure you find the right fit for yourself. Somebody who explains, take the time to acknowledge your fears and concerns. Thank you for that. Any other questions?
Last question I have is from Mishan from Sri Lanka.
All right, Sri Lanka.
All right. Says, I'm 6'1" and 120 kilograms.
Okay.
I'm having bad back pain in my lower back. Pain is too much that I can't carry my own baby and sometimes can't move my right leg like a paralyzed person. I'm a huge follower of you. Can you please help me?
Okay, well, first of all, I think you know the obvious answer. Let's take a look here. So if we, let's do this here. Where is 120 kilograms? So that's, we'll just say you're roughly 240, 250 pounds. So you already know you're carrying too much weight for somebody who's 6'1". So I was going to look up the exact conversion, but that's not important. So first of all, the way I'm going to help you is by just being real with you. Number one, you know you need to lose weight. Everybody that's overweight knows that. It's just a question of doing it. So you have to create an action plan of how to actually do that. And it typically starts with challenging your body at a level where it demands more of your body. So you're forced to look at what you're eating. You're forced to look at your lifestyle. Number two, you've got to make a plan. Anything you want in your life where you want to actually achieve something, you've got to plan and schedule for it. You know, if you want to go to school and get a degree, you plan, you take classes, you schedule the classes into your day. If you want to do anything in life, you plan and schedule. You don't just like randomly get a woman or a man and, hey, I want to marry you. You propose, you pick a date, you schedule the wedding, and then, you know what I mean? So anything in life you have to schedule. So the weight's a part of it. But second of all, you may really need to go to a chiropractor. It sounds like that your body is experiencing subluxation, you're having pain down in your leg, you're having numbness. That usually does come from the lower lumbar spine. These nerves can get pinched or pressed upon when you have subluxation. Very, very difficult problem. It is so hard to be in pain, guys. It just damages your whole day, it damages your relationships. You get on edge, you don't like talking to people, you don't like, it's just horrible. You're always looking for a way out, a way to escape. So please get to a chiropractor, please watch what you're eating. Great question, thank you for being a fan, I appreciate you guys. Quick, some Instagram questions and then we're gonna get rolling. Let's rock and roll here, and let's see here. George Janko on the line, aye, nice. Amaliak says you're a role model. Thank you. George says you're the man. Thank you, George. Takes one to know one, bug. The specific Elk Grove says, hey, hi, Dr. Jason. Waleed. George says, damn, what up, doc? Thank you. What up? Let's see who we got. I'm so out here, it's crazy, says George. All right, let's see. Najara from Brazil. There we go. How much is it to get your back done? Well, we don't do backs, we align spines, my man. So we got to do an exam and a consult. You can contact me about that. I've been to the chiropractor today and I feel good. Yes. Doc, as a chiropractor, who checks you and which procedure do you prefer? Great question from a fellow chiropractor. I just had my buddy Dr. Paul Reed in town. He checked me and adjusted me over the weekend. I prefer full spine, Gonstead style adjusting. There are many techniques out there. Certainly whatever works for you is good. A lot of shout outs, a lot of hellos. Hey doc, how was your day? It's going really well, thank you for asking. How's it going, says Tali? Going well. Let's see here. Doctor, my back hurts. Sorry, get to the chiro. Love your videos. Thank you for that. Hey Dr. Jason, please help Sam. We were just trying to schedule Sam for today. Hello from Ireland. Thank you for tuning in from Ireland, I appreciate that. You're amazing. Takes one to know one, Oliver. Thank you. How's your day going? Hope it's well. A lot of people really kind today checking in. Thank you for tuning in. We'll be here Friday again, 12 p.m. Pacific Standard Time, right here. Ask Dr. Jason. Tweet me your questions at Dr. Warrell. DM me your questions on Instagram. DM me, send them on Snapchat. Tune in. We're out here trying to help you align your spine and your mind so you can get connected, stay connected. Come on. Thanks for tuning in.